Okay, hey everybody, this is Kagome, and I want to talk about breastfeeding and specifically breastfeeding after cancer and really breast reduction. So I've got my 3 week old right here, and I can by no means say that I am the success story, but I can say that breastfeeding after reduction can be done. Now, I'll tell you about my reduction. Now, um, for starters, I only have one breast. Since I had breast cancer, I lost my right breast and I have my left breast, but it's been reduced. And the type of reduction that was done was called the anchor method. It's where they don't remove your whole nipple and put it off to the side. It's basically they make like an anchor style shape. So it goes under, the scar is under a breast like this, kind of like the shape of my shirt here. And then it goes up like this and then around like my head. It's kind of like the whole shape here. It's like this, and then there's a scar like this, and then around the nipple. So it's like this shape, and then your nipple is just like moved up. So I don't want to mark myself doing this, but it's kind of that's the shape. So it's referred to as like an anchor method. I know there's other ones like lollipop and different ones, and there's one where they take the whole nipple and put it over on the table, fix your breast, and then put the nipple back on. But that's not what I had. I had my nipple just moved up and a bunch of skin from the bottom, um, skin and fat and tissue or whatever removed, so it will match the new implant that I got on the right side. So I'm feeding, but I'm only able to feed on the left side. And I wasn't even sure I'd be able to do that. I didn't leak or drip or anything or have any signs that I'd be able to breastfeed while I was pregnant. My breast swole a little bit, but not much. I didn't have much pain. It'd be like off and on type of thing. So I was kind of thinking that I wasn't going to be able to get any milk at all. But fortunately, right after I had him, everything got triggered and I started, some milk started coming out for colostrum, I think it's called, in the early stages. So that was that. Now I'm going to tell you, it has not been easy. It's been more like an uphill battle. For one thing, my little bundle here was born a few weeks early. So when he was born, he wasn't exactly latching on the way I expected he was going to. We did the skin to skin for an hour, and he never tried to find a nipple or anything. He just laid there and slept and rested for an hour. And that could have been medicine too, because I did have an epidural. So he didn't try to like root or anything. He just relaxed, you know. And then from there he had jaundice and he was very tired all the time. So it was hard to get him to eat. I had to wake him up every 2 hours to get him to eat. He had lost some weight and he's just back up to his birth weight now at 3 weeks, which is good. Now, aside from that, this week I've been getting blisters. I I started out, I saw a lactation specialist in the hospital, and I also saw a lactation specialist in the WIC office, and my son's pediatrician's office also has two lactation specialists. And I've talked to maybe six lactation specialists. So I talk to all of them. If they say they want to come in, I don't turn them down because honestly, I need all the help I can get. Because I just didn't know what I was doing at all. And this week I've had some blisters, and I got the blisters because I was having some latching problems before. Not that it was a painful latch, but I couldn't get him from bottle back to breast, which would come from the doctor asking me to pump. Oops, where's she, baby? He wanted me to pump every 2 hours and give him the milk, and if I couldn't get at least 2 ounces, to give him formula to try to get his weight back up and try to get rid of the jaundice that he had. And we were using the Billy blanket and all that stuff, so we had a lot going on, and it was so stressful that my milk just stopped coming, so I had to stop doing that. But then I couldn't get him back to breast, so the lactation consultant introduced me to the supplemental feeding system, supplemental nursing system, SNS, if you look that up online. So this is one that she made in office, but when I looked online, they were basically all like this. Some of them had a bottle on the end or whatever, or just like the end of the bottle so you can connect it to your own milk bottle. So the milk just goes in the syringe part. Then there's a tube here. The tube, you take the tube to your breast, and the end of the tube, this end, goes right at the tip of your nipple. So then it'll encourage baby to stay on your breast, and you won't have to give them a bottle in order to supplement. So if you have to give them extra milk, like say I ran out of milk, and he couldn't get any more milk from my breast, I could put formula in here, or I could put pre-pump milk in here, and I wouldn't have to give him a bottle. I could still have him on my breast, and then he wouldn't have nipple confusion. But the only thing with this was he stopped latching the right way and started just trying to suck the milk from the tube like a straw, like my nipple be here and the tube be over there, and like, so his lips started to pucker. So then I got a blister, a very bad blister, because he was just like chomping on my breast and my nipple, like, yeah, like it was terrible. He was chomping. So I finally got this nipple to pop, but it's still very painful because I still can't get him to latch the right way. And when I first had him, I couldn't get him to latch. And I was introduced to nipple shields. Here's one, and here's the other. One is bigger than the other. I was given these two shields in the hospital, actually, by the consultant that was there. She came in. That's one thing. It's like it's great that they have a few consultants in there, because one will have one idea and then another one will have a different idea. Like I got these from one, and then another one didn't mention those at all, but she did help with the latch and check out his tongue and all kind of things like that. You know what I mean? So if you need help, don't turn away. Don't be like, well, I saw one this morning, blah blah. They put the number on there on the whiteboard so that you can call them whenever you want to, whenever you need to. If you have a question or you need some help getting baby back on, they'll come and they'll help you. So I was introduced to these nipple shields, which are good for if you have inverted nipples or flat nipples, or for me, I have a scarring around my nipple, and it was hard for baby to just latch on. So you put these on, your nipple will come up in there, kind of like my thumb is doing. The nipple will come up in there, and then baby can latch onto this, kind of like it just pushes it out further, so to go further up in their mouth. And then they can put the rest of their mouth around, this part. This part will be like on your breast, and their mouth will be here on the flat part here. And then all this will be up inside of the mouth. So it helps them learn how to latch. And then you can take those off unless you have like inverted nipple. Somebody's talking. Yes, he wants to talk. But so I started out with those. Then I got rid of these. I didn't have to use them anymore. Yes. I didn't have to use those anymore, and I was happy. And then I was also coming home pumping, and I used the Medela pumping system. So it looks like this. It has like the little button on it and everything. Hold on, he's mad. So anyway, I used the Medela pumping system. This was gifted to me by my cousin. at the baby shower. I keep that by the bed like all the time because I have to pump a lot. And it comes with the cone, and then it has these container cup bottles, and they have all the measurements on there. I don't know if you can see that, but anyway, they have it's numbered. You can keep up with how many milliliters you're doing, how many ounces of milk you pump. You have bigger ones that are regular bottle shaped, and it comes with two different size cones. But I use the 27 millimeter cone, so I use that one, and then of course I have this system, and then I have the shields, and I have this cold pack. This cold pack helped me last night. The doctor suggested I go out and get something called Comfort Gel Pack for nursing mothers, and I didn't get a chance to go get one. So, but someone had given this little elephant cold pack to my son at the baby shower. So I just put this in the fridge, and then I just stuck it down in my bra overnight at night to like cool it off after I nursed, because I was like really sore, and I'm still sore, and I'm still having a hard time getting him to relatch, which is crazy because I went to his pediatrician yesterday. I had an appointment with the lactation consultant, and we spent half an hour practicing latching in different positions. It took us that long to get him on. He was finally on and like swallowing good. Then she walked out the room and he just let go and went to sleep and would not get back up. He would not wake up. So I was sweating and everything after that session. And we got home and he would not get on at all. So I was stuck trying to pump all night last night. And the thing about it is, if he doesn't latch and I pump, eventually I won't be able to get any more milk. It'll stop letting down, and it'll slowly go down further and further. Like I'll start out and I can get 3 ounces, and I'll get 2.5 and 2 and then 1, and then I'll be like skimming the bottom. So I have to have him like latch on in order for me to continue getting milk. Because if I didn't, I'd just pump. I promise you, I'd just pump. I would. So we've been doing this for a couple reasons. Wanted him to get all the healthy goodness of the milk since I could do it. And breast milk is free, for one. Formula is like $20 a can. That's insane. Ain't it, baby? That's insane, ain't it? It costs a lot of money. Yes, it does. Yeah, so I thought it would save some money. And I don't have any issue with doing formula because we do have to give him some. We have to supplement because I'm just not getting enough milk right now. I don't know if it'll increase. I pump even after dry to see if it'll trick my breast into doing more. But I don't know. He's starting to drink more now, like 2.5 to 3 ounces. When before he was drinking 1.5 ounces to 2 ounces, and then I could pump and have a little left over and supplement or make sure he had like the real fatty milk, so he could gain weight and everything. But now he's just drinking it all up. He's growing up. He was 6 pounds 15 ounces when he was born, and he dropped down to 6 pounds and 1 ounce, and now he's back up to 6 pounds and 15 ounces again. And he was born at 37 weeks because I had the cholestasis. But pretty much that has been like my whole breastfeeding experience has been very stressful. It's for a good cause, but it's been very stressful. It's like almost every day, like calls from the lactation consultant to make sure we're doing good, make sure he's latching, make sure he's eating, so they could put weight on him, so he could get rid of the jaundice, and it's just been stressful. Like all the skin to skin is like, if it has felt like he's been permanently attached to my chest since he was born. That's what it felt like. And today I finally got one of the Moby wraps, and I wrapped it around me. I put him in it, because it got to the point where if I put him down, he'd just be screaming. I couldn't get nothing done. And I want to figure out how to wear it while breastfeeding so I can at least get some stuff done. Because I worked today and I actually got to cook and wash dishes and clean up the living room. So, hey, what can you do? But that's been pretty much how breastfeeding is going for us so far. Hopefully it'll get better. If it doesn't, I don't know. I don't know how long I'm gonna be able to do this. I wanted to do it the whole year, but if I keep getting sore blisters and stuff like that, I don't know. I really don't know. Might just have to put the money out for the formula and pray that this little boy stays healthy and happy and get right, baby. Look at that. He's on there. He wants the boob already. And he just had some pump milk. He's not getting the boob. He's not getting the boob. No, you're not. You're not getting the boob. Yeah, he wants the boob. You're not gonna get it. No. Wait, Jose. But that's pretty much it. If you guys have any questions or comments or suggestions on how I could make things better or easier, please let me know. I've tried letting him latch on himself and crawl up my chest and stuff like that. But nothing is working permanently right now. So if you guys have any suggestions, please let me know. But I do want you to know that just because you've had a reduction, and I've had really large breasts before my reduction, and I've still been able to get like milk spray out when I pump. So just because you had a reduction does not mean you cannot produce milk. I don't know how much milk you'll get or if it'll keep coming in or whatever, but there's a good possibility, and they've always told me that there's lots of women who have had reductions and things like that have been able to produce milk. And I can get 3 ounces off the one breast. So if you still have both your breasts, you can probably get 6 ounces easy and take care of your baby without supplementing. But that's just me. So please like and subscribe to see more of this handsome baby right here and updates on how things are going. All right, bye you guys.